I became a doctor for mainly two reasons. One is I grew up in a family of doctors. My dad was an internist. He was a traditional doctor with the black bag. He made home-based care reality, and he did that where we grew up in central New York. And that really made an impact on me ever since I was young, because I saw what he did and I went along with him on some occasions, and it had a profound impact on me. The second reason is because as a young child, I had many occasions to see doctors of my own, and that gave me a profound sense of empathy, and I was a direct beneficiary of care, compassion, and skill from really skilled doctors, and that drove me to want to be one. Ophthalmology was something I almost stumbled upon in my elective years in medical school later on, and I'm so glad I did, because it is a unique blend of being able to take care of medical and surgical aspects of vision, and it's one of our most precious senses. And I have an art background. Growing up, I was always involved with art, and seeing the visual and seeing the delicate nature of the eye put together with being able to take care of medical and surgical problems for patients was just a great opportunity. So Retina is unique to me amongst the various excellent subspecialties in ophthalmology, which are so many, because Retina is, there's so much medicine behind it. There's so much you can find out about a patient's health. You can diagnose about their body before they even know it from things that appear in the retina. Also, the surgery involved in retina is so delicate and so precise and amazing that of what we can do to repair and restore sight, those two aspects really drew me to the specialty. And it's also a field that is really involving, and it's on the forefront of medical breakthroughs year in and year out. I'm involved with a lot of the clinical trials looking at improving the treatments and therapeutics we have for age-related macular degeneration as well as diabetic macular edema, both of which are very prevalent. And also I have an interest in improving both the techniques in the office for simple procedures, such as in the injections that we do for those conditions, and in the operating room with improving our surgical techniques and the instrumentation that we have. So we have a collaborative we have a collaborative effort here amongst some of my colleagues within the Retina service to that end, and that's been very stimulating and interesting. Wills Eye is a very special place. I was fortunate enough to do my retina training here in fellowship, and is fortunate again to be able to return as an attending. It is a unique place because under one roof there are thought leaders, there are outstanding clinicians in all of the subspecialties of ophthalmology, and we can do so much collaboratively both on the research end and clinical care end and surgery end of the spectrum to help patients. And I can't imagine a better place for patients to be with unique and complex eye problems, but also just a better place. I can't imagine a better place to be, and I've experienced it firsthand, both as a trainee and as a practitioner here at this institution. In my spare time, again, I like painting. When I have a chance, I do acrylics and oil painting, and just spending time with my three children and my lovely wife. And we like to go on outings and outdoor activities.